Hi, I'm Professor Graeme Yorston. Welcome to 5-Minute Mental Health Disorders. In this episode, I'm talking about bipolar disorder. What is it? What causes it? What symptoms do you get? And how is it treated? The term bipolar is often bandied about rather casually these days, with celebrities claiming to have it and historical figures being posthumously diagnosed with it, such that it has become one of the most misunderstood mental disorders. So what actually is bipolar disorder? Well, in simple terms, bipolar affective disorder is a serious mood disorder characterised by alternating periods of low mood and abnormally elevated mood, known as mania. It has a long history going back to Hippocrates and the ancient Greeks. In 19th century France, it was known as folie circulaire, or cyclical madness, but the term bipolar is relatively recent, replacing manic depression in the 1980s. Bipolar disorder affects up to 2% of the global population, depending on the definition used, and is equally common across all cultures. It can occur at any age, but symptoms most commonly begin in the late teens and early 20s. There are 3 main types: bipolar 1, bipolar 2, and cyclothymia, all of which have symptoms of depression, mania, or both, to varying degrees. Bipolar 1 disorder is the most severe form of the illness. The sufferer experiences extended periods of extremely elevated mood lasting more than a week, known as a manic episode or mania. They may also experience milder periods of high mood and depression, but these are not necessary for a diagnosis. The mood elevation of mania is very different to just being happy. The core symptom is an increase in energy or psychomotor activity, rushing around, not sleeping, talking very fast, thinking very fast. It often makes people impatient at how slow everybody else is, so they can become irritable and aggressive. It may be associated with losing touch with reality or psychosis. Typically, delusions of grandeur such as being convinced you're rich, famous, or some kind of genius. This can then lead to impaired judgment and high-risk impulsive behaviour such as using drugs and alcohol or engaging in reckless sex. Overspending is common, and this can result in lasting debt. We're talking Ferraris here. Without treatment, manic episodes can go on for months, and they are extremely disruptive to a person's ability to work and maintain relationships. A person with mania may feel absolutely on top of the world, but those around them are in no doubt that they are ill. And it always comes to an end at some point, often with a cataclysmic drop in mood to severe depression. This is one of the most worrying times, as people may try to end their lives as their mood just plummets. In bipolar 2 disorder, you have periods of depression alternating with episodes of hypomania. These are briefer and less severe and do not have such a dramatic effect on the person's ability to work or socialise. Cyclothymic disorder, or cyclothymia, is also characterised by periods of high and low mood, but the severity is never enough for them to be categorised as major depression or mania. This is the one that is hardest to distinguish from the normal ups and downs of everyday life. Mania can be triggered by neurological and other physical illnesses and some types of medication. In most cases, however, we don't really know the cause. Genetic factors are important and may account for around 80% of the risk of developing the disorder, but childhood trauma is also associated, and significant life events can trigger individual episodes and relapses. If you have bipolar disorder, you're going to need to see a psychiatrist. It's a lifelong condition that doesn't just go away on its own. Treatment with mood-stabilizing medication such as lithium, sodium valproate, or one of the antipsychotic drugs helps most people regulate their mood to something much more like normal. Psychological therapy is also helpful, and seeing someone and getting treated early improves the long-term outcome. So, although bipolar disorder is a serious illness, for most people it can be effectively managed and people are able to function in high-level jobs and live fulfilling lives with no loss of their creativity or spontaneity. That's it, 5 minutes on bipolar affective disorder. If you have any suggestions for future topics, please leave a comment. I'd really appreciate it if you could like it and hit that subscribe button. Thank you, see you next time.